PSA test, prostate-specific antigen. What's this test about? Does it even work? Do we need it? It's so confusing. Welcome to Talking with Docs. I'm Dr. Brad Wayne.
I'm Dr. Paul Salzo.
We brought a guest today.
I'm Dr. Peter Ince.
A urologist who's going to do a PSA on PSA.
Okay, I like that.
You like that?
So let's start at the beginning. So this is a test that's only like 30 years old, 1986, invented by a couple guys down in Arizona, used to measure a protein that's made pretty much just by our prostates.
That's right.
And the purpose of it, that I didn't know until I started looking into this, is actually to liquefy semen to allow sperm to swim. Is that fair to say, Pete?
It helps them swim.
Help them swim. Okay.
Do you think they could have come up with a better name than, hey, we found an antigen that's specific to the prostate. What should we call it?
Yeah.
Prostate-specific antigen.
There you go.
Scientists aren't usually that clever at naming things.
No, they're not.
They usually name it with their own name.
It's funny they didn't lean on the Latin for this one.
That's right.
Except the planet Uranus. That was a good one.
They changed it to Uranus
Sorry, I didn't know that.
for obvious reasons.
Okay, so this is a test that's a little bit controversial. And when we have screening tests used to help identify cancers, two things that really matter are how specific it is and how sensitive it is. So the sensitivity is, what is the ability of this test to find the cancer? And the specificity is, if you have a positive test, does it mean that you actually have cancer? Is that
Right.
fair to say, Pete?
Well, he's making it sound confusing, which it is.
Okay.
But PSA, first of all, is a naturally occurring substance that is made by the prostate. So every man will have that if they have a prostate.
Okay.
And it's not a great test because it can go up and down for a lot of reasons.
Yep.
And it can be, sometimes it's up, not because of cancer, but for many different reasons. And that's why it's so confusing and controversial, because it's not the best test, but it still is one of the best things we have.
Right.
Yeah, my interpretation of it, after just reading about PSA, because I had to get my PSA measured, is that it's not a great screen. I mean, it's an okay screening test, but its real use comes in seeing how well treatment is going for prostate cancer.
It's excellent for monitoring treatment. That's true, because if you've treated prostate cancer and the prostate is removed, your PSA should go down to 0.
Right.
And so it's excellent. The PSA starts coming up, almost always there's a recurrence.
Yes.
However, apart from that, that's where the confusion sets in.
Got it.
So the big problem is, what do you do with a number when it's elevated?
Okay.
And what is an elevated number? Because as we all know, whenever you have a population, you have people whose PSAs are normally low,
Right.
normally high, and then everybody in between with that bell curve.
Yes.
So how do we sort through it? And that's where the controversy begins.
Okay, so first, I guess the first thing I'd say is, if you have a slightly elevated PSA, it's not necessarily reason to panic, because one test is not necessarily a reliable measure, and we want to follow maybe multiple tests, 2, 3, 4. They talk about something called the launch speed. Is that something that you use in your practice?
Never.
Where the rate at which the PSA goes up.
The velocity. Yeah.
Velocity, that's what it is. Yeah.
So what what the Canadian Urological Association recommends is that you get a baseline PSA at the age of 50,
Okay.
just so you know where you stand.
Now,
Now,
if you have no symptoms of any sort or family history or anything.
well, that's the one thing. Symptoms are not a factor in prostate cancer. So
largely
if you're peeing a lot, if you're getting up at night, that is not a symptom of prostate cancer. That's a symptom of having an enlarged or tight prostate that's benign. So forget about the symptoms, because that almost never happens with prostate cancer. That's why you need a PSA test, because that's the only way you can detect it is with the blood test.
Even though it's not great, but that's what we got.
Or a rectal exam.
Digital rectal.
So at the age of 50, if you have a baseline PSA, and then that can be used subsequently, so we can see what is the rate of change for this person over time.
Yep.
And that helps to guide us for subsequent testing.
Okay, what rate of change is concerning?
So we want to see when your velocity or rate of change, it depends from society to society, but a change of 0.2 over the course of a year is considered abnormal. However, I have to say that there is what we call a gestalt. So basically, that means when we see PSAs, we see them go up and down a lot.
Right.
And what I usually do is repeat them and do a rectal exam.
Okay.
And if they go up and they come down, what we want to see is the PSA over time will go up and down and slowly increase as you get older.
Right.
So your PSA at 50 is going to be less than a normal PSA at 75.
Gotcha.
So obviously you can see there's a lot of factors
Yes.
that influence the PSA and make it confusing. And that's why a lot of society, the Family Physicians Society of Canada, I'm not using the right term.
It's okay.
They actually do not recommend routine screening because of all the problems associated with it. Because if you get that PSA, you become anxious. You then possibly have to go for a biopsy for unnecessary reasons.
Right.
And then you might be subjected to a treatment which is not effective. And basically, it just starts a cascade that overall may cause more harm than good.
Okay. Muddies the waters, you might say.
Muddies the waters is right.
All right, so then the key to the PSA is don't freak out if yours is elevated, if you've had the test or you paid for the test and went and had it done, because there are many factors that can make it go up and down.
Right.
Naturally goes up with age.
Yep.
However, the main thing that a urologist will look for is a rate of change over time.
That's one of the factors.
One of the factors, plus also your ethnic background and other risk factors. And of course, I think the big thing that you guys look for is a family history, because prostate cancer appears to be one of those cancers that is very much tied to your family history, is it not? Like if
It
you
is,
have a family
it is,
history,
but it also can be very random as well.
can be
See how confusing this can be?
already. But I know that that a family, like I've had patients who've come in with prostate cancer, and they're like, oh yeah, well my dad had it, my uncle had it. You know, so often
Yeah,
I see
if
that.
you're in a family that has a lot of cancers, or
Yeah.
specifically prostate cancer,
Yep.
you might even want to get tested before
Earlier.
50.
Sure.
That's another important thing.
Yeah, I've had a patient very recently who had that.
Question I had: if you have a PSA though that you've only had one test, but it's really high, is that ever predicted to say, you know what? I know we don't talk about one number being concerning, but is it ever
Yeah.
like so high? You're like, listen, this for sure is prostate
Like
cancer.
triple, 4 times normal.
So that's the whole point. I think that screening can be helpful because it can alert you for those early cancers.
Okay.
But there's a lot of things that could make it high,
Right.
and we're going to talk about that later
Another
on.
video.
Another video. Okay. All right. So PSA, it's the best we got in terms of screening tests, but it's not perfect.
And there are other tests out there which are going to become more prevalent. There's now with all the PSA testing and other biomarkers, you can get urine samples, saliva samples, blood samples. So it's going to become more sophisticated, but those are not common yet.
Yeah, because this test is from the 80s. You're not listening to CDs anymore, are you?
I
Watching
think it was in CDs in the 80s, was it? That's probably tapes.
VHS,
Yeah.
maybe?
Maybe. Yeah, there you go.
We had the
Cassette.
Beta.
There you
The
go.
one that went away.
There you go.
Anyways,
Okay, so now you know it's worth considering having a PSA test. Some people say, oh, it's just a useless test. We would say that's not true. It is useful, and you have to use the context in which it's taken, consider multiple tests. This is something that's worth talking to your family doctor about if it's something that you're concerned about. And if you like this video, please like it. Subscribe to our channel. Leave a comment about your experience with the PSA test.
and if you found this video confusing,
It is confusing,
that's the idea with PSA. It is just a confusing topic, and there's no one sentence
but it doesn't
answer.
mean it should be ignored.
Right.
Why do you have to pay for it in Ontario? Unless the urologist orders it, you have to pay
If you
for
come and see me, we'll pay for it.
There you go. Come
All
see
right.
Pete.
Remember, you are in charge of your own health.
And thanks for Dr. Insta joining us and telling us all about PSA.
Take care.
See you next time.